We are live. Welcome to our next episode of Decent Med Spotlight featuring Dr. Jeffrey L. Brown, founder of Hormone Health with Dr. Brown. Why did you choose Hormone Health?
Honestly, I think it chose me, to be quite honest with you. Um, I've always been fascinated with the human body, physiology, and I've always wanted to help solve problems. That's one of the reasons why I went into osteopathic schools, because I also wanted to use my hands and learn how to use my hands, to help people with pain and other issues that we can solve with using our hands. And once I got into the functional medicine world and learn about bioidentical hormones and the hormone imbalance and the issues that women struggle with, I saw that there was a huge need for that. Too many times, it's too long. Women have struggled, been suffering, not listened to. I mean, it's just it's saddening. And I also found that it was a nice challenge because it wasn't something that was conventionally done or treated very well. Women only have really three options. It's usually birth control, antidepressants, and surgery. And if those aren't an option, then what are they left with except just suffering for many years? And that wasn't okay with me. So my journey was to learn as much as I could and apply the knowledge, and seeing the results. And it's been an amazing journey. So I want to continue to let women know that they don't need to suffer. It's not necessary. So that's my mission, is let them know that PMS, painful periods, they may be common, but they're not normal, and there is help for it.
That's a great mission. And according to statistics, about 80 to 85% of women experience some type of menopausal symptoms. Most common is hot flashes. Will you focus on pelvic pain, or one of your focuses with that is pelvic pain? And according to statistics, while general pelvic pain itself is reported approximately 15 to 20% of menopausal and postmenopausal women, broader pelvic pain affects over 50% of women transitioning through menopause. So what have you seen in your clients when it comes to pelvic pain?
Well, there's a lot of reasons for chronic pelvic pain, but if we're just eliminating diseases, STDs, those type of things, um, one of the things you're going to see is pelvic floor weakening. That's common, especially as estrogen drops, and that's where it's great to work with a pelvic floor specialist. But getting the hormones balanced are key. Reducing inflammation is key. Improving gut health is key, because the gut health, the microbiome, influences our hormones, and the gut microbiome is where 70 to 80% of our immune system lies. So when we have inflammation, that's basically saying, hey, we've got some GI issues that we need to address, because that's going to affect our hormones. Like, all those things are related. And unfortunately there's a lot of stress. A lot of women have experienced traumas over the years, and when it's internalized and hasn't really been dealt with, that is going to rear its ugly head at some point. And usually, if it's been suppressed for too long, that's about the time where things will start to manifest itself. Especially when they're in that perimenopausal, premenopausal, phase. So that's what I found is really dealing with the stress. The change of the hormones are really key. Reducing inflammation, is key. And once you do that, then things will start to line up, and they will feel better.
So let's go a little deeper, because you are a functional medicine doctor. We know what traditional medicine, how they approach pelvic pain, hormone replacement, and menopause. How does a functional medicine doctor approach some of these issues?
But we address it in a holistic manner. As I said before, in the conventional world, it's really, birth control, antidepressants, pain medication. If it doesn't get any better, then usually, surgery, unfortunately. But like I said, there's so many other causes and reasons for it. So as a functional medicine approach, we're looking at, from the time they were born, looking at their past, because your past affects your present. We're looking at the environment. What are their exposures, the different toxins that create the immune response, the inflammatory response. What does their diet look like? What are they eating? What are they not eating? Are they exercising? What about the stress components, stress factors that we talked about? What type of activities do they have to help with stress resilience? Are they meditating? Are they praying? Are they going for walks? Are they grounding? These are important activities that, help to, keep cortisol down, or at least, calm it down and strengthening our, immune system. And then, of course, truly balancing hormones, looking at the hormones, doing specialty tests, looking at saliva testing, looking at, the free hormones that are there, not just blood work, because blood work is bound hormones. You're not really getting the free hormones when you're looking at blood work. So doing saliva testing, looking at how the hormones are being metabolized through urine testing, so we take a really holistic and deeper approach, to their hormones, so that we can best assess, okay, what's the best way, to go? What do they truly need? It's not about symptom care. Unfortunately, the conventional model is basically what medication can we give them to manage their symptoms. But I want to make sure that they are in balance, so that it's not just about symptoms, because of course, when you balance them, the symptoms will, improve, but also they're going to age and feel better and have a healthier lifestyle and reduce their risk of diseases that you usually associate with women when they get older. But if you do a holistic approach, get them healthier, then you can reduce, the likelihood of they having, dementia or heart disease or cancers, etc. So that's the different approach. The focus really is on balance and overall health, not just symptom management.
Two things you said that are very important. The first one was testing, because I've spoken with a lot of providers that have that same mantra: don't guess, test.
Yep.
And the second one that you said is getting to the root cause. So for you, and how long have you been in this space? And how have you found that testing has changed the course of your approach?
Well, going through the functional medicine testing, my journey started back in 2008. I was trained with American Academy of Anti-Aging Regenerative Medicine, A4M. I was certified in 2010, but, started in 2008 because a couple of years to get through the training. And then as you learn about the different tests and you see what you get there, that you can't get in just traditional blood work. It has truly, it transforms everything, because you can look at, so many things. Looking at the gut microbiome, like the comprehensive stool analysis, we can see specific enzymes. We can see how well your body is digesting the foods, fats, proteins, etc. You can look at the immune health, that way. You can look at the microbiome, the estrobolome and what it's secreting, so truly looking at the gut health, anything that's overgrown, they're out of balance, in the gut, because that will impact the hormones and just, your immune system, overall. Looking at how your hormones are being metabolized through urine metabolite tests, gives us a lot of, good information. So you don't have to guess anymore. There's no assumption. You can actually see what the hormones are doing, downstream when it's being broken down. And so, these tests are amazing, doing the saliva testing, looking at the adrenal hormones throughout the day, the cortisol levels, the free hormones. You can see what's going on there, which is going to be different than what you see, in the blood work, because the blood work is, those are bound to protein as they travel through the blood. The free hormones you can see in the saliva testing, and the free hormones are basically, that's what's doing the work. That is the active hormone, is the free hormone. That was bound to protein, and that's what you see, in the blood. So the more information that you have, the better you can help address, the underlying, issues, and so that's one of the fun things about functional medicine, is that we are privy to and have learned about these different tests, so we can truly look at, toxins, there's so many things. I mean, just the nutritional status, looking inside the cell, we can see what's going on. So it definitely was a game changer. Now I feel like pretty much anything that comes my way, we have tests that we can look at to help our patients to, get better. Try not to inundate them with tests, because it can get expensive. That could be a negative side of it. But at the same time, I think that long term, it will save you a lot of time and money if you can get your questions answered initially, versus, having to go to hospitals and multiple co-pays, co-insurance, that you go from one specialist to another specialist trying to figure out what's going on with you. I always find that, you may spend a little bit up front, but it's going to save you a lot of, money down the road.
And like you said, a lot of their tests are simple blood tests. With you, it's going deeper, saliva tests, stool tests, along with blood tests. So, diving deeper into how you help women, we touched a little bit about menopause, but one of your main focuses is endometriosis. What is endometriosis and why did you choose to dive into it?
Well, endometriosis is a systemic chronic inflammatory, disease. It's not just a hormone disorder. That's what we kind of categorize it as, but it's truly a chronic, inflammatory, disease. I always say it's like a first cousin to autoimmune disorders because they're very closely linked. Where a lot of women with endometriosis have autoimmune disorders because of the chronic inflammatory, condition. And one of the reasons why I got into it, was because it is so, I don't want to use the word, mismanaged, but there's a lot of information that people don't know. And unfortunately, birth control, multiple surgeries to go in there, remove lesions, to help women, with this debilitating pain, they're still not getting the relief, that they need, long term. And so I know that there has to be a better way, and there is a friend of mine who suffers from it, and she asked me about it as far as, could I help her with it? And I said that I could. She actually didn't ask me. I just told her I could. And she looked at me, very, quizzically, like, she'd never heard that before. And then as we went through the process, slowly but surely, she noticed that, she was getting better. And I told her, first we got to get you off the birth control. And I remember seeing the look of terror on her face. And that look of terror is what got my attention because the thought of her getting that period back again was terrifying for her. And I'd heard about endometriosis, before, but I really truly never looked into it. But because of the fear on her face, it made me realize, like, okay, this is beyond, pain. This is like next level pain. And I don't think most of us realized how debilitating, how excruciating this level of pain is. I think we kind of dismiss it, like, unfortunately, women have been dismissed forever because we associate anything with women with pain, as like that's just something they got to deal with, right? With pregnancy, we know it's a painful thing. And I think we kind of group it all together, like, yeah, they're just going over it. But this is truly next level debilitating, pain. And as a man, we don't give birth, so we don't know the level of pain. Even kidney stones, passing one, that may not even be, comparable to the amount of pain that these women experience. And because of that, and really looking into it and see how many people actually suffer from it, like 10% of the population, that's a lot of women, suffering. A lot of women have had, one surgery or multiple surgeries, trying to get, relief, missing work or can't hold a job because, they're having pain too often, throughout the month. It's not even necessarily associated with the period, but it could be throughout the month because of these lesions that can be anywhere, in their body. And so, that challenge there, really, got me, touched my heart. And I said, okay, I know we can do better. And so that's what made me, get involved with it and researching and looking at ways to address it. And it has to be a systemic approach because it's a systemic, disease. And so we have to address it at multi levels, many layers, to it. And when you do that, we're having good success with it. So, I feel really good about what we've done.
And to your point about the pain levels, according to healendo.com, the pain levels can range from about 7 to 10 on a 10 scale during urination or bowel movements when it comes to women. So you're completely correct. The pain is very high. And I think that we do underestimate how high it is. So I want to go over some of your quotes. So you said in wellnessvoice.com, I do not care about a diagnosis. My focus is not on identifying a disease. My focus is on identifying imbalance because imbalance is what drives symptoms. The body is always working to maintain homeostasis. So, using that quote, how does that apply to your work in endometriosis?
Well, one of the reasons why I said that is, too often when women suffer, not just women, but people in general, when they suffer, they want to know, okay, what is it? Right. And they think that once they know what that is, then there's a pill, there's a surgery, there's something that's going to help to solve, the issue. And then what I've told people, it's like, that's not the diagnosis just so they can code it right, in the conventional world. So you have a diagnosis of something. And I don't want anybody identifying with a disease. I said, there's no need to come up with a disease or come up with a name for what you have, it's just not that simple. This is a systemic issue, so I don't need to label it. My goal is to help the body to fix itself, because the body's always trying to get back into homeostasis. And so once you can identify where the imbalances are, I don't need to spend time trying to put a disease or a name, with it. Now, women who have endometriosis, they can say it can take up to 7 years or more for them to get a diagnosis. But even with that diagnosis, what does that leave them with? What birth control, surgery, pain medication. So that the diagnosis didn't necessarily serve them, per se, because like I said, it is a complex, comprehensive systemic disease, and it needs to have a comprehensive approach. It's not going to be treated with, a pill or a shot, or surgery. You may get temporary relief, but there's still underlying damage being done if you're not addressing the gut dysbiosis, the chronic inflammation that's going on there, some of the deficiencies that's going on there, the toxicities that are built up, in there. So if they're not being addressed, you may get a little bit of relief, but there's still other things that's going on. So I don't put a lot of stock into figuring out a diagnosis, because, that's how we are trained in medical school, right? Get your diagnosis, and then you have your medication or whatever treatment is to treat it. So that's kind of how I think people are wired, here in this country, because of how our medical system, has trained us. But that doesn't fit when it comes to chronic diseases. Having that name, is not really going to serve them, what I feel long term, because usually it takes a comprehensive approach. It's not a one size fits all. There's no pill, or a surgery, or anything that's going to address the whole picture.
And to that point, I want to pull up one of your testimonials. This is Jessica R. I am incredibly grateful to Dr. Jeff for the profound impact he had on my life. For years, I struggled with severe cramping, anxiety, and depression, which is why I wanted to bring this up, that accompanied my menstrual cycle. The symptoms were relentless, persisting a week before my cycle and a week after, leaving me in a state of constant discomfort and emotional turmoil. Dr. Jeff's expertise was a game changer. He worked with me to balance my hormones, correct my diet, and overall improve my self-care routine. The results have been nothing short of transformative. I no longer experience the debilitating cramps that once sent me to the hospital, and the anxiety and depression that plagued me daily from significantly diminished. Thanks, Dr. Jeff, my cycle no longer feels like a 3-week ordeal, but rather a manageable aspect of my life. His care has allowed me to reclaim my well being and enjoys a quality of life I never thought possible. I am deeply thankful for his support. So I bring that up because, to your point, a traditional doctor might say, well, let's address the anxiety and depression. But the only reason why this woman had the anxiety and depression is because you went to the root cause of addressing her hormones, and with that, a myriad of issues, including anxiety and depression. Can you speak more on that?
Yeah. She actually was, one of the reasons who I spoke about earlier that got me really focused on endometriosis, because one of the symptoms that I noticed with her first was her mood change. And then at that time, she told me that, her moods would change. She would have episodes of depression, mostly depression and some anxiety, due to the, endometriosis. So even though she was on the birth control, she still was suffering from, other things, and serotonin, that our feel good hormone, 70% of it is made in the gut. And so you got to focus on the gut. We spent a lot of time working on that, doing the special testing, like I told you, the comprehensive stool analysis, addressing what I found, in that test. And then once you do that, and then again, look at the hormones, get her off the birth control, get her off the depot shot, let the hormones come back naturally and see where they are, where the imbalances are, and then address those. And then once you address those, plus the nutrition, again, it's a systemic approach. Understanding, okay, what are the stressors, looking at some of the food allergies that's creating more inflammation. You got to look at a systemic approach. And then once you do all that, then all of a sudden the healing starts. The body becomes happier. Like I said, the body's always, letting symptoms doesn't mean that your body is broken. Your body's trying to communicate with you. They're telling you that, hey, I'm not feeling good here. We need to spend some time figuring out what that is. And once you give the body back what it needs, or remove, that what shouldn't be there, help to get the body back in the balance, then the body's going to be, be happier. But a lot of her mood issues were, gut related, the inflammation, that was present, some of the stressor, some of the past things that's going on, working through those things, that's how people get better. It's a systemic approach. It's not just a one size fits all. So once we did that, she was in a much better place. And that's why, it was easy to ask for, testimonials, because they just will tell you anyway. They say, yeah, of course, whatever you need, you changed my life. And that's why I do this. It's life changing for people. That's why we went to medicine in the first place, to change lives, so people get into a better place.
100%. So moving on to perimenopause and menopause. So 2 questions with this. One is, do you use herbs in helping with menopause and perimenopause?
Yes, I mean, I do use herbs, to some degree, because they can help to, reestablish balance. Herbs are important for adrenal health, because again, we live in a stressful society, and we need a lot of herbs to help our adrenals, the resilience, and to help to build and repair. And adrenals and our stress, they impact how our hormones work. And so I do use, herbs, for that. But primarily, my goal is to, help to establish, the hormones. And there are some herbs that can help to facilitate producing more progesterone, or more testosterone. So there are herbs, to do that. So people who don't want to necessarily use hormones, for whatever reason that may be, unfortunately, there's been, fear mongering out there, and, bad studies that led people to believe that, hormones cause cancer. So some people still have that in the back of their, their head. But I tell them, it's like, no, our bodies, there's nothing more natural than hormones, that your body produces them. And so, I always focus on, establishing hormone, balance through using hormones. But we know we use herbs when we need to. And so when the hormones are in balance, then everything else is going to work better, because we have hormone receptors all over our body.
So the second part of that question is regarding gut health. And you spoke on gut health a little bit earlier. How has addressing gut health in your patients affected their move from perimenopause to menopause?
Well, it's a piece of the puzzle, right? You're only as healthy as your gut, and that your gut microbiome is linked to, all diseases, right? From cancer to Alzheimer's to Parkinson's to obesity, diabetes, heart disease. You can link the gut microbiome to a lot of these disorders. So it's really important to have a healthy gut microbiome, and more research keeps showing you that it's really important that we maintain that. And so if you have a healthier gut microbiome, they're going to influence your hormones. It's going to influence how your hormones are being metabolized, especially, estrogen, how much is going to be reabsorbed and how much is going to be, excreted. And then that's going to help with that progesterone estrogen ratio. So it's really important that we, help our gut do what it needs to do, so it can communicate with the other bacteria that's, all over our body. And so it plays an important role. And so that's why diet's really important, giving us the nutrients that we need, for a number of reasons, for, energy production, the mitochondrial health, reducing inflammation, building, repairing, and, and feeding the gut bacteria, the microbiome there. So that's why diet plays a crucial role. So if we're eating more inflammatory foods, more toxins, fried foods, processed foods, that's inflammatory, that's not helping our gut microbiome. So diet is really important. So having a healthy gut, is a very important part for healthy hormone metabolism. You can't have one without the other. If you don't have a healthy gut, you are going to have some hormone imbalances.
So back to the gut, another thing that you address is PMS. And the 7 symptoms of PMS is bloating, which obviously ties to gut health, breast tenderness, fatigue, mood swings, irritability, food cravings, and headaches. So with your patients, have you seen some of these, and how has addressing gut health mitigated some of these symptoms?
Yeah, I like to put people on a anti-inflammatory diet, prior to us even doing anything. So what I find is, when we do testing, the first thing I'll do is do a 2-week or a 4-week detox plan, and oftentimes a lot of them come back and say, well, my energy's better, I'm sleeping better, the bloating's better, my skin looks better, energy's better just by changing, their diet and giving them some nutraceuticals to help reduce inflammation and to help with the detoxification process. Even before we do anything else, just by getting rid of the junk, putting in the good things, being more strict with the diet. And again, like I said, using some of the nutraceuticals, to help their body move better and work better. We've seen, a lot of improvement just with that, which gets them, of course, excited about what's coming next, because all they did was right now is just, did a little dietary change and take some supplements to get things moving. But, a little can go a long way. So yeah, we've seen significant improvement just by, diet and taking some supplements to help the liver, the kidneys, and gut health improve.
So to that point, is there any specific foods that are best for women as they're going through these changes?
Fiber, is really important, because that helps with estrogen metabolism. You got to go to the bathroom, drinking enough water. Fiber is key. Unfortunately, I see too many women who are constipated or not having regular bowel movements. And so that's really important because you don't want to reabsorb those toxins. So fiber is really important. And also, healthy fats and then protein. What I find is women are not getting enough protein, so you got to maintain that muscle, because one of the complaints that women have, one of the most common ones, of course, is the weight gain, so you want to be able to build muscle, so, by building muscle, you're going to be able to increase your metabolic rate and strengthen your bones and maintain posture and just, feel better, overall, because that's what your body needs to build and repair the amino acids. So if we're not getting enough protein, then that's going to be a problem. And especially since a lot of women have, the stressors, in their life. And so they're going to be in more of a catabolic state, and your body's going to be breaking down, protein, in muscle. So you want to make sure that we're getting plenty of protein and amino acids to help to build, and repair as you're going through the changes. Those are your building blocks. The amino acids are the building blocks. And so you don't want to be breaking down, you want to be building, as we age.
And to that point, this study is according to pmc.ncbi.nlm.nih, PubMed Central. High fiber diets have been associated with reduced risk of cardiovascular disease, stroke, diabetes, colon cancer, and breast cancer. Have you seen your work regarding breast cancer? Have you seen that your work has mitigated, or have you seen that people have early signs of breast cancer, and how your work can help with that?
Yeah, I've had people with breast cancer come to me, for assistance, helping their body to get, healthier. Fortunately, people who've started with me, I haven't had any, issues with it, because those are the things that we're looking for, as far as like, how are your hormones, metabolizing, and if they're not metabolizing in a healthy way, we can see that. And if you can see that, then you know what you need to do to help address those things. There are things to help, improve how the body metabolizes estrogen, right? And that's why the cruciferous vegetables, are very important for that. High fiber diets, are important, for that. Iodine is really important for, estrogen receptors and breast protection. So there's a lot of things that we look at, as far as testing and looking at, that we know that are breast protective. And so that's very important for me is reducing, the risk of, any estrogen related, cancers per se, the breast, ovarian, or, uterine cancers. And so that's what we do, the testing that we do, so we can look at it ahead of time and see what your body is doing with everything, the inflammation markers, the metabolites, looking at how things are going in that way. So if you look at these things ahead of time, you can stop them before they happen. And that's when the fun things about functional medicine. And when you do this, you're in this space, those are the kind of tests that we run, so we can see, what is your body doing with what it has, are you missing certain nutrients? Are you having elevations of enzymes like beta-glucuronidase that you'll see in doing a comprehensive, gut analysis that shows that your risk for breast cancer or colon cancer is higher? And then there's things that you can do to help to reduce that risk. And so when you have these tests at your disposal and you run them on a regular basis so you can keep your patients healthier, and educate them on this is how we prevent or reduce your risk for breast cancer, ovarian cancer, etc. I love what I do. It's fun. We don't have to worry about your patients having issues as long as they they follow recommendations, they do the test. You can see these things.
So moving on to our next condition, PCOS, or now it's commonly called PMOS, polyendocrine metabolic ovarian syndrome. And correct me if I'm wrong, but I know that one of the common things associated with PCOS or PMOS is not being able to be pregnant. So have you seen any of your patients that had PCOS or PMOS, and after working with you, now they were able to have children?
Yeah, I mean, PMOS, they've changed names now, so it's gonna take a while to change and get that out of your head, right? We've been with PCOS for so long, so it's hard to unlearn something than to learn something new. But really, the insulin resistance, that's the issue, and also chronic inflammation, right? If your body's inflamed, your body's not in a healthy state, right? So if your body's inflamed, your body's saying, hey, we're in fight or flight now, right? You don't want all this inflammation, going on. And with that condition, then you're gonna have elevated androgens, insulin resistance, higher insulin. And so once you can reduce that and get the body back into a healthier state where insulin is in a normal range, you're reducing, inflammation, progesterone and estrogen are in a healthier ratio, then that's all the body wants. Then it feels like it's safe. And then once it has a safe environment, it feels safe to, bring another life into this world, then it's going to be easier to achieve. But if you're staying in a state of inflammation, if you're staying in a state of, that insulin being elevated, insulin resistance, that metabolic disease, then it's going to be a lot more challenging. So typically, no matter what it is, if you can get your body to feel safe and in a healthier environment, then your chances of getting pregnant or just, feeling better overall is going to be much higher.
And to that point, this according to Johns Hopkins Medicine, 35% to 80% of people with PMOS experience insulin resistance, and they're more likely to experience obesity and type 2 diabetes, or what's now called diabesity. So have you come across patients that either had diabetes or obesity in conjunction with their PMOS, and how do you address it?
Yeah, haven't had the diabetes, but obesity, or definitely being overweight is extremely common. That's probably, I see that a lot. Unfortunately for them, I mean, we haven't had the type 2 diabetes risk associated with that. And again, it's just changing the lifestyle. It's addressing the underlying issues. And one of the underlying issues, of course, again, is the gut health. And so addressing the gut microbiome, because there's a lot of this association with the gut dysbiosis, meaning that imbalance within the gut microbiome. Addressing that is key. Looking at what they're eating and consuming, some of the processed foods, the inflammatory foods, that has to change. Fasting is really important too. I'm a big fan of fasting, because obviously when you're fasting, you're not releasing insulin. It gives your gut a break so it doesn't have to work as hard. Gets a chance to, if you're not secreting insulin, then we're not bringing sugars up either. So fasting is a key strategy that women can do. There's, of course, with the menstrual cycle, the follicular phase is important to do it during that time as estrogen is rising. We call that cycle syncing, with the hormones, where it's not as stressful in the body, because fasting can be stressful to the system, so you want to do it during a time where it's not a stress, to the body, where you're raising cortisol, because that's going to be counterproductive if you're raising cortisol, because then you're going to be having insulin and everything else go up, as well. So fasting during the follicular phase from night to morning, I'm not a big fan of telling people to skip breakfast. So fasting from, the maybe 5 o'clock until like 8 or 9, that would be, ideal. So there are some strategies that you can do to help with, bringing insulin down. And then there are supplements and herbs that you can use as well to help to, bring those supplements down for those who don't want to use, medications. Of course, exercise is very important, right? So there are strategies that you can, employ to help to, improve the metabolic syndrome that's associated with these women and exercising lifestyle. It doesn't mean that it's a life sentence. So if you're willing to put the work in, we can help you to make those changes and restore balance in the body. That then you can have a very productive, energetic, vibrant life.
It's a very impactful point that you made about skipping breakfast because one of our practitioners, Lori Graham, a functional nutritionist, mentioned to your point that when postmenopausal women skip breakfast and do intermittent fasting, their blood sugar actually spikes. So I like that you made the distinction that it's fasting from dinner to next meal. It's eating earlier versus not eating at all in the mornings.
Yeah, because what I find is, especially in Americans, we like to snack at night, right? And it's very popular to skip breakfast, but I say your body's ready to go in the morning, right? It's secreting hydrochloric acid, is ready to digest some protein and and get started, the fuel for the day. And if you're putting that off, that and of course you're going to get different opinions on this, but from my opinion, it's like, yeah, you should have something in the morning because that's when you're starting your day. Your body, your brain needs fuel to get started. And so for me, it just makes sense to fast, when you're fasting anyway, was when you're sleeping. So if you got 8 hours there where you're already fasting, maybe you just, eat your dinner earlier. You can add another 3-4 hours to that. So now you have a 12-hour fast, or you can go to a 14-hour fast where now your body can rest. The digestive system can rest. You don't have to your body doesn't need to put the energy towards, digestion, during that time so that it can, facilitate healing. And then during that time, you're not spiking your blood sugars. You're not raising insulin, so that's a good amount of time to help to restore balance, if you're doing it during those hours. But during the morning hours when your brain is trying to work and your body is ready to go, you're not giving it any fuel, well, that could be a stress to the system. And like I said, we already are too stressed anyway. People's adrenal function, cortisol is high. And so you don't want to let your body feel like it's stressed. And so eating a little something, whether it's a smoothie or, something small, doesn't matter, but putting something in your body so it doesn't feel stressed, I think is important.
So you brought up protein. And obviously, a big fate or craze is the idea of vegan diet. How impactful or detrimental is a vegan diet on a woman in perimenopause, menopause, and postmenopause?
Yeah, it's funny when you talk about that because that is probably one of the most controversial topics, in the health space. If you bring that up, there's going to be a lot of, pushback when it comes to, because a lot of the vegetarians out there, they swear by, what they believe in, but I am a believer in the meat, and you have to work really hard, to get the other nutrients that you're not getting by if you're avoiding, the meat. And so, to make your life easier, I just say, eat meat, get enough protein, that way, as far as your bone health, your muscle health, because as you age, muscle is really important. We all see it, people who are wasting away, as they get older, that's because you're not getting enough protein. You're not building, you're not repairing. You're not getting the B vitamins, the CoQ10, the full spectrum of the amino acid complex that you need as far as your essential amino acids is crucial, to get all those nutrients. And you have to work much harder. Some of the sickest patients that I've treated over the years in the functional medicine space were people who were vegetarians, and because they were missing nutrients. And so, and we've all seen it. And so, you have to work really hard to supplement, and my thing is, life is stressful enough, so why not, make it easier on yourself and just eat, give your body what it needs, eat the appropriate, food. I mean, if you look at our, our dentition, we have the canines, incisors, that tear through meat and chew the meat. We're omnivores, so, that's my stance on it, because we got to get a full blend of nutrients and amino acids, and red meat specifically, is really important to get everything that we need, from our diet without necessarily having to supplement all the time. So if you just eat meat, you're going to get everything that you need, for the most part, without having to worry about supplementing with, other shakes and proteins and, everything else to make sure you're getting what you need. Especially when you're exercising, because if you're exercising, then there's going to be a higher requirement, which means that if you're not eating meat, then it's going to be even more difficult for you to get all the protein that's necessary for you to build and repair, efficiently.
And that's a great point because there's a massive distinction between men and women. And even when you think about something like sports, in sport, you look at Serena Williams, who's the best tennis player of all time, and she's not a strict vegan. She follows a primarily plant based diet, but it includes chicken, fish, and other animal proteins, versus her sister, who even her, and she had a diet of Sjorgen's syndrome, but I think even she transitioned to a less plant-based diet. So that's interesting because for men, I've seen like Chris Paul, for example, who's a basketball player that's a vegan, and he had a long career. But I wonder how the vegan diet played a role in some of the injuries that even he had later in his career. So, moving on to another condition, PMDD, premenstrual dysphoric disorder. How does that differ from some of the other conditions that we went over today?
Um, Honestly, just by name, and PMDD, is listed, in the psychiatric handbook. So they've been taught, and people believe that it's a psychiatric disorder. And then you'll find people in my camp, we just shake our head, and I just say, hey, that's just another ploy by the drug companies, so they can sell more drugs, more, you know, antidepressants. If you look at the history of that, so-called disorder, that's what you'll find. Again, it's all about imbalance. You know, like I told you, serotonin primarily made in the gut. You got to address, the gut dysbiosis, which is, the imbalance of the gut microbiome. Really important that once you do that, and help to reestablish balance of the hormones, because that condition really happens, that week before the cycle, where the mood is really, really severe, really devastating, so whether it's PMDD, whether it's severe PMS, those are all, hormone imbalances, gut dysfunction, inflammatory disorders. And you reduce inflammation, you get the gut back into balance, the gut health into balance, help to restore balance, that estrogen progesterone ratio. This is really important. Once you do that, then, that goes away. They don't need to be on antidepressants for that. I know that's the main treatment for it in the conventional world. And we all know that not everybody feels good on antidepressants. And so, for me, that's just another, frustrating thing, as women suffer and struggle through certain hormonal, conditions. That's what all they're left with is, antidepressants, for that, or maybe birth control. A lot of them believe that they have a psychiatric disorder, because, where the drug companies, when their medication is going off patent, they figured out a way to, to have another indication, for their drug. And so, that's an unfortunate, thing, but it is the world that we live in, right? It's they control, how medicine is practiced, and, they fund, our medical research, so that's why it's geared, that way. It's not a holistic approach. But PMDD, again, it can be addressed the same way the other things that I spoke about, as far as addressing the gut, reducing inflammation, and reestablishing, hormonal balance. They will do much better.
So I know that you work with autoimmune diseases as well. And just circling back to the statement I made about Venus Williams, she adopted a vegan diet on the recommendation of her doctor after being diagnosed with Sjorgen's syndrome, a
Yep.
debilitating and incurable autoimmune disease which causes excessive fatigue. Doctors encouraged her to adopt a raw vegan diet to help manage her diagnosis, and her sister and fellow tennis players took on the diet to support Venus. She was once told that the raw diet would help her fatigue and joint pain, and she stated, "I was diagnosed with an autoimmune disease, and I wanted to maintain my performance on the court. Once I started, I fell in love with the concept of fueling your body in the best possible way." So, with you, who also helps with autoimmune disease, how have you seen the diet, and you said again, you talked about eating meat. Have you seen people with Crohn's and other autoimmune diseases improve by changing their diet, utilizing some of the things that you recommend?
Yeah. So when people ask me, when we have this conversation, like I said, there's some people really passionate about, their diet. And, we're all different. We all have, a different genetic makeup. And I don't believe that there's one diet that, fits everybody. I mean, I actually truly believe that we should change it up, periodically. Honestly, if we look at, you know, thousands of years ago, people ate, what was in season. And when you did that, guess what? You changed your diet. You're probably eating, more carnivore during certain times of the year. Certain times of the year, you were eating, vegetarian, right? Because that's all you could get was the, plant-based things. And then maybe sometimes you had a combination of things, and I believe that as you change your diet, you are going to be changing the microbiome. And we know that having a diverse microbiome is the healthiest way that you can be. The more diverse the microbiome is, the healthier you are going to be. And so you change that, you improve diversity by changing what you eat. So one of the things I tell my patients all the time is, you should really change. Don't eat the same foods all the time. So if there's a period where, we're going to do extended fasting, maybe there's a period where you're doing a vegetarian, diet, maybe there's a period where you're doing more of a carnivore or keto diet. But changing it up, I think, is really important as you change the microbiome, changing the diet. But basically, you can do certain tests. Basically for me, I like looking at, food allergies and food sensitivity testing, because then I can see what's creating an inflammatory response, in the body. And then once you eliminate those foods or those family of foods that you can see that your body has a reaction to, that's how I would address the autoimmune factor. It's not so much of, eating, keto, or vegetarian, plant-based, et cetera. I like to test to see, okay, what family of foods does your body seem to have an issue with where it's creating an inflammatory, response. And then once you do that, then you can slowly start bringing back foods in once you've kind of, eliminated those foods, for a while. And I've seen great results with that. People have seen tremendous results with that. Once you eliminate those foods that you have a response to, so that's my approach. Like I said before, I do believe in changing up what you eat. Don't eat the same food. I know we're creatures of a habit. Just because we live in America now, or just in societies where we can have what we want whenever we want, just because of the time that we live in. Right? You can go to the grocery store and find whatever you want. Whether in season or out. But I usually encourage people to try to eat during season. Change it up is really important. Don't eat the same things all the time. That's how you're going to keep the microbiome healthy, by changing things up. Improve the diversity by changing the diet that you consume.
And to that point, something that I want to note here is that you work with lupus, rheumatoid arthritis, Hashimoto's, ulcerative colitis, and Crohn's disease, which she had Sjorgen's syndrome, which affects the exocrine glands, and some of these others affect the joint lining, the skin, the kidneys, the joints, thyroid gland, the large intestines, and the colon, and the entire GI tract. So, looking at this, do you think that certain diets are different depending on certain autoimmune diseases? Or since you're a functional medicine doctor, it's all about looking at it from a personalized approach based on the individual and what the individual has, like you said, with the food sensitivity test?
Yeah, I am more at the camp of testing and focusing on what the testing shows for that individual. Whether you're doing genetic testing, food allergy sensitivity testing, you're testing for the individual. That's where I am. I know there's some doctors who just, all they do is carnivore diets. There's some doctors that focus on just fasting, or just keto. Like some people just focus on certain diets. I like to be more personalized, do the testing, let me see what your body is testing and what it's telling me. I don't just stick with one camp. That's not my philosophy. I think we're all, individuals. So we need to see what your body is responding to, so that's my philosophy when it comes to approaching, autoimmune disease or any disease, actually. Okay, what is your body telling me, based on the tests that we run?
And I think that's very important to note, that last part you said, that no matter the autoimmune disease, it's about taking that individualized approach to disorders. So, any final thoughts, Dr. Brown, that you'd like to leave for the audience?
Yeah, I mean, the biggest thing that I want people to know is that your body's not broken. No matter what you have, the body has an intrinsic ability to heal itself. And I truly believe that. You just have to figure out, what that is, what's missing, what's blocking that pathway. Is there a toxin somewhere? Whatever that is, just, keep searching and don't give up, because the body was beautifully made, and you just got to keep, fighting to figure out, what that is. And that's it. Just don't give up. Keep hope, and just keep fighting for your, for your health. That's what I would say.
At Hormone Health with Dr. Brown, they support women navigating complex and often overlooked hormone related conditions, including some of the conditions we went over today: endometriosis, premenstrual syndrome, premenstrual dysphoric disorder, perimenopause, menopause, polycystic ovarian syndrome, and autoimmune disorders like lupus, rheumatoid arthritis, Hashimoto's thyroiditis, ulcerative colitis, and Crohn's disease. Too often, diagnoses are delayed, and symptoms like pelvic pain, fatigue, mood swings, and fertility struggles are dismissed as normal. Take a one on one virtual consultation today. Dr. Brown helps women uncover the root cause of their concerns and take confident, informed next steps towards better health. Visit hormonehealthwithdrbrown.com to learn more. Thank you for joining us today, Dr. Brown. And everyone, you can visit Dr. Brown at his website as well as decentmed.org/menopause. Everyone have a great rest of their day. And this has been Decent Med Presents, spotlighting Dr. Jeffrey Brown.
Thank you.